somebody asked, could you give some sort of practical advice for doing low potassium family meals, or could you point people in the direction of that?
Yeah. So, I mean, one thing that I find that patients sort of struggle with is family eating. And I mean, eating is not just about getting nutrients and, everything. It's about, sitting down socially with your family and enjoying a meal together, and not having to feel that you're different to people and that you're having to avoid certain things and everybody else in your family can eat, as they want. So this is something that patients find really difficult. And as dietitians, we sort of try our best for each individual patient to look at their biochemistry and, try and give them as much freedom as possible within limits to the biochemistry. So, we'll try and tailor, try not to overly restrict people. We will try and sort of give them ideas of meals that they can cook with their family, and simple changes that they can make to a normal meal, so that they can enjoy it together. As I mentioned earlier, Kidney Care UK have got Kidney Kitchen, and the purpose of this, I mean, it's actually been designed by a kidney patient. It was her wish to sort of, develop recipes for people with kidney disease, so they could do this, they could sit with their family. And all recipes are designed for families in mind. And perhaps, it might be that they include things like mango, which is something we normally tell people not to eat. But the recipes are tailored so that the whole family can eat it, enjoy it, and it might have a little bit of mango, and the overall potassium content has been analysed and is suitable for a low potassium diet. Renal dietitians are involved in helping to produce these recipes. So Kidney Care or Kidney Kitchen is somewhere where I often send patients to get lots of practical recipes. And also, I mean, different departments will have some recipes that they can share with people. I know at Christmas time we in Leicester have, recipes that we can share with people, and it's certainly something that we're looking at doing some more of, making patient family friendly recipes for patients in terms of following restrictions, both potassium and phosphate. I mean, it's really hard to follow both those restrictions, so we hope to try and make it as easy as possible.
So Karen, can I just jump in? So I've just got an anecdote. So I was at a meeting and there was a kidney patient who was a chef, and he ran a company that supplied all the foodstuffs for a local pizza chain. And I guess if you asked Una how much sodium is in a pizza, with all the toppings, it's a pretty nightmarish amount. And what he did in agreement with the restaurant, but he didn't tell any of the customers in this big chain in the US, is he slowly dropped the sodium content in all his ingredients. And I think he got down to almost half the sodium content over a period of 3 to 4 months. And there wasn't a single complaint in the restaurant because he did it slowly. And people kept going to the restaurant. They ate the food. They thought the pizzas were as good as ever because he was a kidney patient and he knew how important sodium was. He altered all the ingredients, the tin tomato, all the things, just dropped the sodium content that he supplied to this train, and nobody complained. And I think, Una, one of the things we kind of do, and I certainly do, is a bang or bust. I'm either having it or I'm not having it. And you go from having a nice sodium-filled, rich diet to something that isn't, and you think it tastes bloody awful. But actually doing it subtly is probably most part of the key to actually changing diet and maintaining that over time, isn't it? Particularly if you're trying to influence the rest of your family.
That's it. I mean, it's sometimes shocking how much people actually add salt to food. So not only is the food salty, but the salt that they're adding. And what I say is don't stop it. Just, every week, just cut down a little bit and a little bit more. And eventually you'll get to a point where you actually can taste the food better. I mean, I've had patients that say, I actually can really taste my food because, 6 months ago I was adding loads of salt, and over time it's actually, the salt's gone down and the food tastes much better. I don't have a very strong salty taste in my mouth. But yeah, definitely your taste buds adapt, and if you experiment with lots of different flavors, so all different herbs, spices, you can get really nice recipes.